Good afternoon, everybody. My name is Carl, I'm a recovery coach here at Capital Recovery Center. This is our family meeting for the day. The article I have here is Family Addiction. How does addiction affect families? It says, how does addiction affect the family? Substance misuse and addiction affects a family on every level: emotional, psychological, financial, and social. A parent's preoccupation with getting drunk or high can lead to neglect or abuse. The use of alcohol and drugs can lead to financial hardship, poverty, or bankruptcy. Shame and embarrassment over a family member's intoxicated behavior can lead to social isolation and avoidance of friends or relatives outside the home. These factors can create a destructive cycle in which substance misuse leads to emotional pain or mental instability, which can trigger an even greater craving for alcohol or drugs. Worst of all, addiction undermines the loving, trusting relationships that sustain a healthy family. Children may be forced into a parental role by parents who can no longer function independently. Spouses may hide their addictions from their parents or their partners, lying about their actions, and parents of addicted children may go to great lengths to rescue a son or daughter from a destructive lifestyle, only to experience the heartbreak of seeing their child return to that lifestyle again and again. Restoring those relationships, which were often damaged long before substance misuse began, requires time, patience, and the support of knowledgeable addiction professionals. So I was always on the one end of um, like me being the child in the family. My mom, suffered from my actions of me being an addiction, and I really didn't know. I mean, I knew that I was causing harm, but like I didn't know the extent of how much chaos and conflict I was causing her. And as we a lot of us know that it's just not like the individual that suffers, like the family also suffers. And as a recovering addict, that I was selfish and self-centered, and like I really didn't care about no one but myself. And like I put my life in jeopardy every day, and I also put people that I love and care about in harm's way. It's just addiction can be a very selfish disease that it's hard to shake and hard to break. So I'm very grateful and very fortunate that like my family and friends like supported me um, when like my mom never gave up on me. Which I'm very shocked that I still have her love and caring and support. Because like I put her and everybody else through a lot of pain, a lot of suffering from my actions. So if you're struggling with a family member or you're struggling, it takes some patience, it takes some time, it takes a lot of love and care and understanding. That's a big thing too, like understanding about the disease of addiction, right? If you don't know, you don't know, and that can kind of be hard to understand. We might have an idea or a concept of addiction and what it does, but if you have a family member suffering, so it's good to get like some professional help or to have, like read up or have a better understanding what addiction is, so you can give them the help that they need. Let's see. It says how addiction affects children. It says United States national and state estimates indicate that 21 million American children live with at least one parent who misused alcohol or drugs, and more than 2 million live with at least one parent with a substance use disorder. Children of parents who misuse drugs and alcohol are at an increased risk of neglect, poverty, and mistreatment, as well as a higher risk of developing a substance use disorder themselves. There is no doubt that parental substance misuse interferes with the physical and emotional development of children. Yet, addiction also affects the health of the family as a whole. For all members of a household to have rewarding relationships and healthy lives, substance use treatment must address everyone in the family, not just the individual who uses drugs or alcohol. When researching the resources available for families affected by addiction, it's important to consider the emotional, psychological, and physical needs of the individuals who occupy the home. Yeah, because like we can cause a lot of chaos in the home itself. Um, that's why, for me, I always say, like, the individual just doesn't suffer and doesn't need help in recovery, right? The family also, like a therapist, counselor, family therapy. There's a lot of avenues and a lot of things that the family is going to need to deal with somebody in substance use disorder. It takes a lot out of the families, and it causes a lot of harm in the home. It can cause fight, arguments, stress, anxiety, depression. You take everyone down with you when you're wrapped up in the disease of addiction, and it causes a lot. And it talks about the financial part of it, like I robbed and stole and used people for money. So like I put a final burden on them. What else? I lied. I was untrustworthy. You know, like I wasn't welcome in some people's homes and stuff like that. So there's a lot of that goes on when somebody's struggling with substance use disorder. So that's why it's always important to have the family come together for support and also receive the help that they need from the impact of the disease of addiction. It says how to approach addiction in the family. So it's never easy bringing up the subject of substance misuse with a family member, but in most cases, the person with the problem will not be the one to initiate this conversation. That's true. So whether your loved one is your child, parent, or partner, there are certain techniques you can use that will help to make this difficult decision a little easier and less painful. By the same token, some approaches and attitudes should be avoided to reach your goal of getting help for your loved one. Um, and it's a difficult discussion that it talks about, and it's painful, it's sad, and but like it needs to be addressed. But you have to. It talks about like certain techniques, right? So like we have to do it in like a loving, caring way, because if we go into a conversation, any kind of conversation, hostile, angry, frustrated, usually the conversation is not going to go good. You add fuel to the fire, and like we're just treading water, and we're not getting nowheres when we're like focused on our emotions and feelings and uh, how we behave and what we say. That add fuel to the fire and make things a lot worse. So we definitely have to be aware and conscious of like this person's already suffering, this person's already hurting. So like let me figure out the right words or right way to say this to help somebody, because I know for me, I was defensive, right? I would lash out. I would say not some nice things because I was hurt. I was already suffering, and I didn't know how to cope with my feelings and my emotions and deal with my disease of addiction, right? Like it was just tough, and like I didn't want to face it. So like somebody coming to me and approaching me about my addiction, it was hard. You know what I mean? So it's like for me, it was I became defensive, and so we just have to find the right way to say things or how to say things to like get the help that they need. That's the focus, right? We try to focus on the solution of like getting the person the help that they need, and whatever that looks like. To be in this article, it talks about little other things that we can help our loved ones. What kind of treatment that they need. Let's see here. It says, what is an intervention? Let's see what intervention may seem necessary when a loved one is either unaware or their problem substance use of has previously declined to get the treatment. Interventions typically involve several loved ones who gather together in a safe space to talk to a family member or a close friend about their substance use. It's a time for everyone to express their concerns and encourage the individual to get help. Some professionals can help with this. You might seek help from a doctor, a mental health professional, or addiction care specialist before approaching a loved one with an intervention. Many believe that interventions can be an effective approach to convince a loved one to seek treatment, and with appropriate planning and guidance, this may be the case. Still, researchers don't have enough evidence to understand the efficient of interventions that because while interventions can be effective in helping someone start treatment, they may be ineffective in helping them complete treatment or sustain their sobriety. And that, it just depends on the individual. At the end of the day, it depends on the person if they want the help or not. And it's there's no right way or wrong way to get the person the help that they need, because it's hard because you don't know like at the moment if that person is angry, upset, frustrated, or on substance or detoxing. So it just depends on the moment and the situation and on the person. And interventions do happen. I've seen that when people and loved ones come together and they do an intervention, and some people go and some people don't go. But I know for me, if you approach a family member or a friend or a relative, in a loving and caring way and try to get the help that they need, you did your part. Like I said earlier, if you go into the conversation or the situation with a tone of voice, right, with anger or frustration, or being upset and like what I say or how I say things, that can really turn somebody away and like not get the treatment they want. It doesn't. It's just how we try to get the help that the person needs. And how we say things. But it's tough. It all depends on the person if they really want the help or not. Let's see here. It says how to get your loved one into treatment. There are several reasons why individuals don't seek treatment, including denial, the belief that they can quit whenever they want. I tried that. I was very in denial because I tried to quit on my own and I knew when I can stop, and that just never worked. Whenever they want, fear, the stigma associated with substance misuse, privacy concerns, the cost of treatment, the geographic location of the treatment facility, admission availability, problems, and more. Seems like to me just all excuses, right? Convincing them to get help is going to take patience and effort. You'll want to do your research on addiction and rehab options. Yeah, do your research, man. If you really care to love somebody and you want to get the help that they need, do your research. Look up on things, read and ask questions and seek professional help so you can get the help the person needs, So here's the first one, right? It says detoxification. Often the first step is more comprehensive treatment program. Drug detox allows the body to rid itself of the substance and our toxins while under the supervision of a medical professional during medically managed detoxification or loved one progresses through withdrawal as safely as comfortable as possible. Yes, I had to go to detox many, many times, and talks about professional help. Like I always tried to do it on my own, or somebody would help me try to detox. It just never worked. I highly suggest if somebody's struggling with substance and then they need detox, please get them there or show them the way to get there, because they do a medical safe withdrawal. Medications are all involved. You're on watch, not like watch, but like you have nurses and doctors taking care of you and watching after you, and makes the withdrawal a lot less painful than me trying to do it myself. And me trying to do it myself, it can lead me back out the door to use substance a lot more. You know what I mean? So like, it's always good to go to like a medical setting to get the detox treatment that you need. And this next one is inpatient rehab. Inpatient or residential treatment can be very effective, especially for individuals with co-occurring mental health disorder. Your loved one lives at the facility for the duration of treatment, where they receive 24-hour care, including counseling, medication, and therapies. And that helped them understand the thoughts, emotions, and behaviors that lead to the substance misuse in the first place and teach them effective ways to cope. So here's like, there are steps to it. Like, you go to a detox, and when you get done the detox, you can go to inpatient rehab. So it's a little bit longer of care. So like I always tell people that, like, take much as time as possible. Take care of yourself, and because like it's tough. It's tough to stop using drugs and alcohol, but it's tough to stay stopped, right? That's what part I was missing every time I got clean and went to like rehab or jail or anything like that. It was hard for me to stay stopped. I didn't know how to live on life in life terms. I didn't know how to deal with my emotions and feelings and stuff like that. And it talks about counseling, medication, therapy. All that stuff is crucial in recovery. As soon as we put drugs and alcohol down, we still have a lot of problems. We still have a lot of defects and shortcomings and things we have that we have to address and deal with. And that's what, the first part is going to detox and stuff like that to put the substance down and start to physically feel better. So the next one is outpatient programs. Outpatient services often mirror inpatient care, but your loved one remains at home or in a sober living residence and visits the facility for individuals, groups, and family therapy sessions. And behavior therapy services too. This option may work well if they retain a supportive, substance-free home environment. So outpatient IOP. So this is another crucial step that when you get out of treatment, whatever how long you stay there, outpatient is like you go 2 or 3 times a week. You have your counseling sessions, you have groups, you have meetings, one-on-one sessions and stuff like that. And it keeps you on a straight path of recovery, and it keeps you accountable, reliable, a little bit structure-based, what I really needed. I needed structure because in active addiction, like I didn't listen to nobody. I didn't take no direction. It didn't matter who it was. I was always running off self-will, and I didn't care about and listening to anyone. So I need a structure base to help me out to be reliable and accountable, and to just have eyes on me at all times, because like I just I was rebellious. I wanted to do things my way. I didn't want to have to I want to say to talk to people talking down to me or tell me what to do. I was always just doing things my way. And like outpatient does help you, give you a little bit of structure and gives you people to be visible and available and accountable. And it's very just not outpatient programs, but like things that we do after we get out of treatment that we have to continue to do, which for many years, like I said, I didn't do. I didn't stay on track of recovery. I always went to the detox or the inpatient, right? I skipped outpatient because I didn't do what was told to me to do when I was in inpatient rehab. I got out and I just kept doing the same stuff over and over and over again. And, I had family support. I had people in my corner. I knew where to get the help I needed, but I just didn't follow direction. And here's the big one. Aftercare. Once formally treated, it concludes ongoing services helping your loved one avoid relapse and maintain long-term recovery. Programs may include mutual help groups, counseling, alumni events, and more. So the aftercare. Yep, and that's something that we have to do for the rest of our life is aftercare, and whatever it looks like that for the individual. right? There's many pathways that, you know, one thing we do here at Capital Recovery Center, and for me, like we welcome all pathways of recovery. And, you know, we have to have something, you know, we have, like some of the things I do for my recovery, I join a 12-step fellowship. I go to therapy, right? I go to church. I have a God of my understanding. I'm helping other recovering addicts. I'm in service to my family, my friends. Like I'm a productive member of society. You know, I treat myself good today, and I treat others like I want to be treated. So, and I do that on a daily basis. You know, a lot of things I do on a daily basis, and I work on myself. Right, I try to change my thinking, my behaviors. I just want to be a better person, and it takes work. And that's one thing I never did. It was aftercare. I always went to treatment, or I went to jail, or like to a different facility. Did what I had to do there, and then I didn't. When I got out, I didn't stay on the path. Right, I started to do what I wanted to do, and I ended back in the same cycle over and over and over again until I did something different this time, like aftercare, and continue to do aftercare. I started to get better. You know, I started to get better. But this disease of addiction does impact the person, but it impacts the family and everybody around them. So it's important, very important that like the family also gets the help that they need so they can live their lives because I guarantee they definitely impacted by their family or friends that are in addiction or been impacted by addiction. Also mental health too, because you know a lot of us know that you know drug addiction and mental health go hand in hand, and so we have to treat both. You know, we have to treat both, and sometimes we don't know if it's the addiction part or the mental health part that we have to um, address first. That all depends on the individual itself, you know. So you really have to like get a better understanding of like you know the disease of addiction and certain things with the mental health aspect of it, because it's crucial. You know, if we need to get the help that we need or help the person that we love, we have to be understanding and understand what's going on with them. So that was our end of the meeting for the day. And my name is Carl, I'm a recovery coach here at Capital Recovery Center. And this was our family meeting for the day. So next time, we'll see you later.